Welcome back to the deep dive. Today we're tackling something that's been developing quite rapidly in the U.S., the H5N1 avian flu situation.
Yes, it's definitely caught the attention of public health folks. Important stuff to track.
Absolutely. Especially, if you're following current events, thinking about policy, potential challenges down the road, this one ticks those boxes.
It really does. It touches on animal health, human health, how they connect.
Okay, so let's lay out the basics. What are we seeing here? Based on reports, H5N1 has spread really fast through U.S. dairy farms.
Yeah, remarkably fast. We're talking over 1,000 herds affected since just March 2024. That's quite a footprint across the country.
1,000 herds, wow. And it's not just contained to animals, right? There have been human infections.
That's the concerning part. Over 70 human infections reported. And tragically, one death confirmed in Louisiana back in January 2025.
Right, I read about that. A 65-year-old individual had pre-existing conditions and contact with sick birds in a backyard flock. Is that correct?
Yes, that's the information reported. Contact with infected birds seems to be the key link in these cases so far.
Okay. And we've got input from several sources here. U.S. health experts, the Global Virus Network, or GVN, Dr. Verman, Dr. Johnson, the CDC, all reported via the Hindustan Times. Our mission today, unpack this, look at the risks, the different takes.
Exactly. Piece together what these different experts are seeing and saying.
Let's start with the GVN. They sounded a pretty strong warning, didn't they, about the virus being in mammals?
They did. Their concern is logical. When a virus like H5N1, typically found in birds, starts circulating widely in mammals like dairy cows, it gets more chances to change.
Change how? Like mutate?
Precisely. Every time it replicates in a new host type, there's a possibility of genetic changes, mutations. And the worry is that one of these changes could make it easier for the virus to spread between humans.
Which it currently doesn't do easily, thankfully.
Correct. Right now, it's primarily bird-to-human, or in these recent cases, cow-to-human contact. Human-to-human transmission seems very limited, if it happens at all. But that's the potential threat that GVN is highlighting.
So they're calling for more action?
Yes. Better surveillance, knowing where the virus is and how it's changing. Standardized testing so everyone's on the same page. And thinking about vaccinations for those at high risk, like farm workers, and even for the animals. Proactive steps.
Makes sense. Then we have Dr. Sten Verman from USF Health. He talked about understanding the situation being critical.
Right. His point was about needing a clear picture for effective prevention and response. He emphasized that this virus hits both animals and humans.
That One Health idea again.
Exactly. You can't just look at human health in isolation. He stressed being proactive, monitoring things closely, and being ready to react fast because of this dual threat.
And Dr. Mark Johnson at Missouri University, he had that comment on X, like something about the virus really trying hard.
Yeah, it was an interesting turn of phrase. He said, it's getting a lot of opportunities. He wasn't saying a pandemic is definite, not at all.
Okay.
But it suggests, the virus is very active in these animal populations. Loss of transmission means lots of replication, which links back to that mutation risk the GVN mentioned.
Okay, so we have these concerns about potential future risk based on the virus's behavior in animals. But then there's the CDC. What's their take?
Well, the CDC's assessment is a bit different in emphasis. They're saying that despite this outbreak in dairy cows and the human cases, the immediate threat to the general public is still considered minimal, low.
Minimal risk to the general public.
Okay.
But they're not ignoring it.
Oh, definitely not. They stress preventative measures, especially for people with close contact with infected or potentially infected animals. Farm workers, vets, poultry workers.
So specific advice for specific groups.
Right. And they're tracking it closely, working with states, using their existing flu monitoring systems. They also point out H5 is common in wild birds globally, and these recent human cases are linked to dairy and poultry work.
So let's try and synthesize this. We've got the GVN and experts like Dr. Johnson pointing to the rapid spread in animals as a serious concern, raising flags about future mutation potential.
The what-if scenario.
But the CDC, while monitoring carefully, assesses the current immediate risk to most people as low, focusing on targeted precautions.
That's the crux of it. Potential future risk versus current low general population risk. Both perspectives are important.
And this entire situation, as reported by the Hindustan Times, is really relevant for you, our listeners, particularly if you're preparing for UPSC exams.
Absolutely. This is a classic example of a current event with major implications: public health, policy, even economics potentially. could easily feature in mains or prelims.
It highlights the need to track evolving health threats, understand the science, and analyze the different expert opinions and agency responses.
And critically, to see how information from different sources, scientific bodies, public health agencies fits together, even when there are differences in emphasis. That's a key skill.
So we hope this deep dive helped clarify the H5N1 situation. If you found it useful, do like, subscribe, and please comment if you have more questions for future discussions.
And maybe leave you with a thought to consider. Faced with these kinds of emerging zoonotic diseases, viruses jumping from animals to humans, what are the most crucial steps governments, organizations, and even individuals should be taking for better preparedness and response?
A critical question indeed. Thanks for joining us on the deep dive.